Welcome. These are gentle back exercises designed to improve mobility and build strength throughout your spine. You can do them 2 to 3 times a week, at your own pace, in your own space. They usually take 10 to 15 minutes to complete. They're demonstrated here by a real patient living with spinal stenosis, so everything you see has been carefully chosen for safety and effectiveness. For more information about these exercises and his journey, scroll down to the video description. Let's get started. Exercise 1, Lower Back Rounding and Arching. Position yourself on all fours on the floor. If needed, use a cushion under your knees for comfort. If getting to the floor is difficult, you can lean on a chair at knee height to keep your back as horizontal as possible. Make sure your hips are stacked over your knees. Now gently round your lower back and hold that position for 5 seconds. Then reverse the movement, create an arch in your lower back, pushing your bottom out as much as you can while you breathe out. Hold for 5 seconds. Repeat 6 times. Remember to breathe in as you move. Exercise 2, Arm Reach Under, also known as Thread the Needle. From the same position, reach one arm under the opposite arm. Hold this stretch for 5 seconds while breathing out. Keep your hips directly above your knees. Repeat 3 times with each arm. Exercise 3, Neck Rotation. Still in this position, gently rotate your neck to one side and hold for 5 seconds. Then rotate to the other side and hold. Repeat 3 times each way. Exercise 4, Back Stretch, Floor or Chair Version. Now lean back so your knees come towards your bottom. This will stretch and relax your lower back. If your knees make this uncomfortable, sit on a chair and lean your upper body forward, resting onto a pillow placed on your thighs. You'll get a similar stretch without any pressure on the knees. Stay in this position for 1 minute, and focus on slow, relaxed breathing. Exercise 5, Opposite Arm and Leg Reach, also known as Bird Dog. Back on all fours, hips over knees, shoulders over wrists. Look down at the floor and keep your neck relaxed. Now reach forward with one hand and extend the opposite leg backward. Try not to let your pelvis or lower back move. Imagine you're keeping a tray balanced on your back. Hold for 5 seconds, and repeat 3 times on each side. The patient in this video is doing a more advanced version with a hand weight and a resistance band around the legs, something you can work towards over time. Exercise 6, Arm Sweep while lying face down. Lie face down. Start with the backs of your hands placed in the small of your back. Now sweep your arms around and forward until your palms are resting on the back of your neck. Hold for 5 seconds, then return to the starting position. Repeat this 6 times. If the floor is too uncomfortable, you can do this lying on a bed. Exercise 7, Bottom Lift, also known as a glute bridge. Lie on your back with your legs bent and feet flat on the floor. Make sure your knees are directly above your ankles. Begin by squeezing your bottom muscles to tilt your pelvis backwards. Push through your heels to lift your hips, rolling up one vertebra at a time. Try to keep your thighs relaxed to avoid cramping in the hamstrings. At the top, hold for 5 seconds with your bottom muscles clenched. Lower down slowly, one vertebra at a time, until your hips return to the floor. You can also perform this exercise on a bed. In the video, the patient is doing a harder version with added weight on the hips and a resistance band. Exercise 8, Bottom Stretch with Neck Strengthening. Bend your knees and cross one ankle over the opposite knee. While holding this stretch, press the back of your head into the floor as you make a gentle double chin. Hold for 5 seconds. Repeat this 3 times. Now, keeping that chin tuck, lift your head slightly to look at your feet. Hold again for 5 seconds. Repeat 3 times. Swap legs and repeat both neck movements in that new position. Exercise 9, Hip Hinge Standing. Stand tall. Drive your hips backwards, keeping your back straight. Don't let your knees move forward, they should stay above your ankles, with your weight in your heels. The patient in this video is using heavy weight, but if you're just starting, begin with just your body weight. Before adding any weight, it's very important that you can maintain the natural arch in your lower back. Thank you for watching, we really hope this helps. You can find other useful resources, tips, as well as rehab products and exercise equipment to support your journey at physiokit.com.